Maybe you're a healthcare clinic owner who has built up a great business over the years and gets amazing outcomes for your patients. Maybe you're a podiatrist or an osteopath or a physiotherapist and you have an amazing team to help you get there, which is great because there's so many people out there who need your help. As a business, you of course charge what you're worth to get people the outcomes that they need, to get them out of pain, to get them living the life that they want to lead. However, if you are like most clinics who I speak to in podiatry, physiotherapy, osteopaths, when you go to advertise your services online, you tend to charge people straight up out of the box full price for your services. And you're worth that, of course you are. But people don't seem to respond to any paid ads that you put out there. And there's a big reason for that. Stick around and I'll tell you why in a moment. Tim Lumsden's my name from Tim Lumsden Online, helping healthcare clinics generate new patients online using online strategies and Facebook advertising so that you can continue to treat your patients and to run your clinics, and you don't have to worry about doing all this stuff so that you can focus on your areas of expertise. So what is it? What is this thing that you need to be doing to get people to respond to your online ads? I just want to premise this by saying we're talking about ads. There's two sorts of ads that you can get, that you can run online. There's ads where people are actively searching for your services, and there's also ads where people are not searching for your services, but they see them. So an example, the first one is on Google, where people are actively searching for help, they want to get out of pain, etc. Or there's the sort of people who see ads, or the sort of ads I should say, that are shown to people who are on social media platforms like on Facebook. Now, for the latter one on Facebook in particular, which is still, by the way, the #1 platform for finding patients online, I know because we do this for clinics every day, so these ads on Facebook are so effective when they're done well, but only when you don't try to charge people for your full services the first time that they've seen you. And you might be scratching your head wondering why. Well, why is because they don't actually know you. They don't know your clinic and they weren't actively searching for you. Yes, they're in pain, but at that particular moment, they were doing something else on Facebook. They were looking at things, watching videos, speaking to their friends, catching up on stuff, who knows, but they weren't actually looking for help to fix their pain. So the thing that you can do as a clinic owner to get your ads or to make your ads effective in this space is to give people a special irresistible offer that they cannot refuse to get them into your clinic. Now this special offer, yes, it's going to involve a discount off your usual rate to see someone, but what it should never do is give people a discount off treatment as such. Why? Well, because when you say to people, I'm going to give you a discounted treatment or even a free treatment, which I wouldn't do, by the way, is that you attract the wrong sort of person who's very unlikely to become a long-term patient because they're just in it to try and find something for free. However, for the people who genuinely need help, by offering them a discount on an initial assessment is going to get them into your clinic where they will learn more about you, you'll learn more about them, and build trust in the clinic in that initial consultation so that they can then make a decision as to whether they want to go ahead and get the treatment and the help that you can give them, because that's what it's all about, right? So when I said earlier about charging full prices for your services up front, that's why you wouldn't do it, because people don't actually trust you when they're looking on Facebook and they see an ad for a particular service that you offer. Hope that helps. Go out and try it. Go and run a discounted offer on one of your services for an initial assessment to get them in the door, and then get to know them, convert them, and then, wow, you're able to help them. they're helped, they're happy, you're happy, because then you can actually then charge them full price for your services after that, get them great outcomes, and the cycle continues.